Welcome to AXREM Insights, developing healthcare through medtech and innovation. Join Melanie Johnson and Sally Edgington as they talk with our industry leaders and experts.
Hello, I'm Melanie Johnson and I'm here with Sally Edgington. Welcome to our final episode in our partnership podcast series. Today we have the pleasure to be speaking to Jemimah Eve, the Director of Policy and Impact at the Institute of Physics and Engineering in Medicine, almost commonly known IPEM. Welcome, Jemimah. Thank you for being on the show and allowing us to get to know you a little better. With our podcast CMPM's partnerships, I will start by handing over to you to tell us a little bit about yourself and your story.
Thanks, Melanie. So my name's Jemimah Eve. I'm Director of Policy and Impact at the Institute of Physics and Engineering in Medicine, IPEM. I've taken a bit of a convoluted and scenic route to my current role. My first degree is in chemistry and my subsequent doctoral research in surface science. So I do have solid background in physical sciences. But this took me, first of all, into a career of research in industry in the area of formulation stability, where I was applying novel imaging and analytical techniques, which is the closest that I've been to imaging and medical physics since then. A voluntary redundancy led me to a career break where I focused on my small children and considered my next move because I was really keen to move outside the laboratory environment. So I had a desire to use my research and critical analysis skills somewhere with a greater focus on public good and with a really increasing interest in health. It led me to IPEM. So my first role was to set up the Workforce Intelligence Unit so that the organisation had its own in-house understanding of the medical physics and clinical engineering workforce. This was implemented because we really didn't feel like we had a proper understanding of our members and, or more importantly, our potential members, what their needs were and how they were going to evolve in the future, which is part of what the workforce series of workforce surveys generated. But it also led to a real understanding of the training needs. I could see where the gaps were and where they were going to be coming. So in 2020, I also took on training and later added events as a form of delivering CPD as head of workforce and training. Then last year in 2023, IPEM reorganised to support a new plan and strategy for growth. And I now lead the policy and impact team, which brings together the scientific leads, the workforce intelligence and the communications functions with an aim of providing insights drawn from the whole organisation to form policy, develop and implement advocacy campaigns, and most importantly, create resources and content which supports all of our members in their professional day-to-day lives.
Wow, you've been very busy.
I was just going to say the same.
Well, that does cover 11 years.
Yeah.
And that was a good snapshot for 11 years. And it sounds like your role is very wide and you have a lot of visibility. And it's clear to see that you're really passionate about what you do. So I just wondered where that passion comes from and what are your drivers?
Oh, that's a great question. Well, I'm passionate and enthusiastic about many things, and I don't think I could put anything into a role where I didn't really enjoy the day-to-day work and was fully signed up to the end result. I'm passionate about the third sector and making a difference. I'm also really passionate about data-driven decisions and using robustly sourced significant information to support policy formation and decisions. IPEM's mission, vision and values are improving health through physics and engineering and medicine. I love physics, I love engineering, and I'm passionate about the healthcare sector. And then that alongside the vision of developing the professional, improving healthcare is just aligned so closely with my professional values. And there's so much that's possible with IPEM. In fact, a key challenge that we're looking to overcome is prioritization. So ensuring that we work on project and then deliver on them to have a real impact by drawing all of the dots together across the organisation, because it's very, very easy to be running very many things in parallel, but not actually see all of them through to completion and have the impact that they could have. So that's what I'm focusing on for this year.
Fantastic. And I know that certainly since I've been in post, IPEM and AXREM work together on quite a few things, and we're quite aligned. Obviously, our vision is we want to improve healthcare and we have a very patient-focused membership as well. So I know you've covered one of your kind of main challenges, but what are the kind of main challenges and commitments that IPEM have over the coming months?
Well, our members tell us that their main interests and focus are three things: advocacy, practice guidance and community and networking. And the community and networking is really where a relationship with AXREM come in, as does the practice guidance, in fact. So over the next few months, I'm looking to not only continue to develop and share this practice guidance, but looking for ways to share it, store it, and signpost this content most effectively to ensure that our volunteers' hard work has that maximum effect and benefit. A hard worked on document buried away on a corner of the website is not of use to many people at all, possibly only those who are involved in creating it. That's a challenge to focus on for the next year is how to make the best use of sharing that. This practice guidance, our policy and position statements, as well as other contents, are all developed through collaborations and working groups, such as the AXREM Ultrasound Focus Group and the AI think tank, as well as the Clinical Imaging Board and the Radiotherapy Board, and a host of volunteer groups within IPEM. So we're really pleased to support and grow the community by participating in creation of and sharing the output. Are you able to tell me, Sally, a bit about the cybersecurity paper that's coming out in the next few weeks?
Yeah, so we actually launched that. Gosh, it must be last week now. Time flies when you're having fun. But yeah, so basically, our members told us and have been telling us for quite a long time, obviously, their concerns around cybersecurity, and we're seeing it more and more. Obviously, we've had the recent London attacks, which meant that operations and lots of appointments had to be cancelled. And with an NHS that is already having backlogs in certain areas, that's really not an ideal situation. So I think that we want to engage with the government, and certainly want to see the government seeing cybersecurity as a national defence thing. It's very, very serious. It should be seen alongside a form of terrorism, because if someone does a cyber attack on the whole of the NHS, can you imagine the impact that could potentially have? And when we think of a cyber attack, we might think of, like, I'm sitting here in front of my laptop and computer, but actually most medtech devices are connected in some way to an IT system. So if there was a major cyber attack, potentially, my members provide CT scanners, MRI, ultrasound, everything could go down. Diagnostics could stop, along with lots of other areas of the hospital. So I think our paper is basically highlighting our concerns and, what impact a potential cyber attack could have. And there's a few calls to action on the last page, which I'd very much welcome people to read. But yeah, it's just a big area of focus, and we've actually set up a working group, sort of a permanent working group now, because I think this is going to be an ongoing situation with the threat heightened, with various things going on around the world.
Oh yes, no, I mean I more than agree. Clinical safety and security is going to be so significant over the coming years, and I feel we've really got to work hard to keep up with the pace of change in this area. And our traditional methods of sharing information, they're going to need to rise to the challenge of keeping up in such a fast-paced environment. I mean, cybersecurity, also encompassing the ethical integration of AI, is one of our three grand challenges that are present in IPEM's science leadership strategy. So yeah, it's very much at the forefront of all of our minds and shaping our area of activity.
Yeah, absolutely. And everything has to be safe for patients. It is also all the patient data in terms of a cyber attack and AI, etc. Is we just need to make sure that we're protecting the NHS, the patient, and our country at the end of the day.
Is so important. We recently launched a manifesto with 5 key asks for the new government. The snap general election did take us slightly by surprise in getting that out there, but we did manage just to get it out in time. But yeah, one of our key asks there is actually ensuring AI is deployed in the interest of patients, because there's so much going on there, and it is, like we say, moving so rapidly.
It is. No, I totally agree. And we've got an AI special focus group, and it's all about safely upscaling. And I think when I first joined AXREM 5 years ago, there was quite a lot of skepticism around AI, and obviously there still is. But I think we're seeing a lot of AI champions within trusts now. I think that especially given the workforce crisis, AI is going to be a solution to help with that in terms of creating efficiencies, workflow, triage, and other things. So I definitely think there's a place for AI. It's just like you say, making sure it's safe, it's patient centered, and the right AI is deployed in the right places.
In the right place, and the professionals involved understand what their role is, how they fit into optimizing the use, and like you say, addressing the workforce crisis, because that's an element of very key importance to us. There's quite a significant workforce crisis. That the challenges don't seem to be going away. As I said, my first role at IPEM was in setting up Workforce Intelligence Unit, which gives IPEM its own data on the medical physics and clinical engineering workforce employed within the NHS. And the numbers haven't been improving over the last 10 years. It feels like our knowledge is we've sat on the side and watched this crisis continue to develop. It hasn't got any worse, and we feel like we've had an impact, but there's definitely a problem there that is the another one of our grand challenges of our science leadership strategy.
Yeah, thanks, Jemimah. And I love to hear that you mentioned obviously the community. I know we've obviously had a conversation before about this, and obviously we're going to both support each other and collaborate where we can, and obviously build that wider community. So, like I say, for me, that's a big focus, and I really want to build on that. So it's great to hear that. So going back to obviously IPEM again, what kind of activities and events are IPEM undertaking for the remainder of the year? Have you got lots planned, or?
We've got loads planned. We've had a very busy first 6 months. We've got a very busy back end of the year as well. Our big focus in the coming weeks is the Science, Technology and Engineering Forum, which is our annual cross-specialism conference. We're going to be held in London on the 8th and 9th of October. We're looking forward to Chris Taylor from AXREM giving a sustainability keynote speech at our sustainability session, because that's the third one of our grand challenges in the science leadership strategy. But other really important events for us are the development of our Future Skills Commission, looking ahead to what skills and training will be needed to support the physicists, clinical and biomedical engineers of the future, including clinical risk management for digital safety officers. We've got a course on that coming up, linking back into the digital safety that we were just talking about. But another element, really excitingly, is and talking about improving our community and relationships. It's a roundtable with our industry members on what the challenges and difficulties may be in the industry workforce, because we really want to expand our engagement with industry professionals. Our Workforce Intelligence Unit has very much focused on the workforce within the direct healthcare, but this year we're looking to expand that to both industry and academia, giving us a real insight where medical physics and clinical engineers are employed right the way across the profession. So adding into that, we've got a member of staff who's focusing on what needs our company members have, and so how we can support them best and what interactions and community we can provide for them. We're looking to grow our company membership, and our innovation grants have been relaunched this year, again with a focus on collaboration across industry and academia. The Prizes and Awards Committee are reviewing the applications right now, and so I'm also really looking forward to announcing the successful applicants and projects around about October time. We've got a clinical computing symposium coming up. There's lots and lots of activity. But like I said, our really big focus over the next few weeks is the STEF, the Science, Technology and Engineering Forum. We'll be looking forward to seeing AXREM members there.
And I'm looking forward to attending that as well, because I will be there, and I'll actually be presenting with Chris. So I'm there for both days. So I'm really looking forward to kind of engaging with your members more and finding out and learning more about IPEM and potential opportunities that we might be able to collaborate on. And it's really good to see that in your workforce strategy that you're going to be involving industry as well. I'll be really interested to find out more about that and kind of what findings you make, because that's obviously of great interest to the whole sector. So kind of looking further ahead and horizon scanning, what do you think are the biggest challenges that you can see for your members in the future?
Well, I've kind of already talked quite a little bit about that. Our horizon scanning work formed the basis of our science leadership strategy with the 3 themes and 3 grand challenges. And this is already forming the backbone of our decision making in terms of direction to take and what to support future science, what activities to really put the majority of our effort into, which is why so many of our activities I've already talked about are aligned with these. So our 3 grand challenges are climate change, workforce, and clinical safety and security. So, we talked about cybersecurity and ethical integration of AI and machine learning, and then again, harnessing these to meet other challenges of workforce, such as skills gaps, but also sustainability. The ambition of achieving net zero in the health service is a critical but really ambitious target, especially given the workforce challenges. There's an awful lot to go out there with strata right the way across the patient pathway for changes to make and best practice to be shared. So I think that's the biggest challenge.
Yeah, absolutely. And I agree with you. That's a big challenge for us. And we have IPEM, a representative from IPEM sit on our sustainability special focus group, which has been really, really useful for us. And we get updates, and it's that two-way communication between what you guys are doing and what we're doing, so that there's no duplication and that we're all kind of aligned. But I do agree that for industry, the net zero targets are very ambitious. And I think that it's not easier, but I think the larger companies have got a real hand on it. But I think SMEs, it's a big task for a small company where you don't have a full-time member of staff taking care of the sustainability credentials of your organisation. And I'm sure it's the same within the hospitals, where there's not necessarily huge teams of people that have got the capacity to do it. And it certainly seems from the interactions that we're having with different organisations like yourself that there's a real passion within the NHS to want to help them achieve this target. But I think it is important that we're all talking like we are, to make sure that we can help each other along the way, because there's no we see in AXREM there's no competitive advantage to this. We all need to win the war of net zero together. We all want to make the world a better place for our children and their children.
Oh no, absolutely, and that's a really good way of putting it. We're united against a common enemy, which is carbon consumption. And like you say, what's so important here is to avoid the duplication of effort, sharing best practice, and really disseminating that out as effectively and as far-reachingly as we can, so that we bring that ambitious target closer to becoming a reality.
Definitely.
Thank you. So now for my quirky question, Jemimah. If you could have any superpower, what would it be and why?
Well, building on the theme of sustainability, I think I'd go for teleportation, including the ability to take my family with me. I spend an inordinate amount of time transporting my teenagers around to sports fixtures, and them learning to drive isn't going to fix the environmental drain on doing so. So yeah, I'm going to go for teleportation. Environmentally friendly way of getting around would be absolutely amazing. In addition, many of my family live abroad, and I don't see them nearly often enough because of the time it takes to get there.
No, do you know what? I think that would probably be my choice, actually, as well, as a superpower. I think that would be incredible. Like you say, just click your fingers and go wherever you want, and then come back within a few hours. It would be great. So
yeah, absolutely. I really value face-to-face connection, and I'm a big fan of a in-person meeting to kick off a project, or first working together. But that time constraints, resource constraints, and sustainability considerations mean that that's increasingly not possible. So yeah, I'm going to click my fingers and be there.
Oh, wouldn't that just be so amazing? When I think of how much time I spend on public transport, if there was just an instant way. And as Mel knows, I hate flying, and I've actually plucked up the courage to now book a flight to ECR next year, which I've tried to avoid any flying for the last 5 years. So so I would love to click my fingers and just be there, so I don't have the whole anxiety around flying. But no, that's fantastic.
Well, when Mel grants me my superpower, we'll hold hands and I'll take you there.
Oh, thank you. So Jemimah, thank you so much for joining us today on AXREM Insights. It's been really interesting. We've learned loads more about yourself and IPEM. So I just want to say a big thank you to Jemimah for being our guest for today, and thank you to all of our listeners.
Join Sally and I again in a few weeks when we will be speaking with Dr. Ram and Steve Clark from the International Imaging Congress. If you have enjoyed today's podcast, don't forget to hit subscribe, or feel free to share the podcast with friends.